I decided to join the United States Navy because it's always been in the back of my mind to do something more. As a social worker, that's one of the things that we do. We enjoy helping others. We enjoy doing our part to make it a better world. And I have always valued what service members do for the military. I'm Lieutenant Bryan Pyle. I'm a licensed clinical social worker in the United States Navy. I was a licensed clinical social worker before I joined the Navy. I worked as a crisis counselor. I worked as a therapist for families and children. I also worked as a clinical care manager within a managed care behavioral health setting. My practice as a Navy social worker is different than it was as a civilian social worker, mostly because I wear the uniform and I represent the United States Navy. At the same time, I'm also bringing to the table the same level of clinician skills that I would as a civilian. One of the unique aspects about being a clinician within the military health system is that it's not a for-profit driven system. The focus is not to get the numbers of patients in to get the revenue up. It's something that's completely off the table. I can focus strictly on the patient care needs. Recently, one of the sailors that I worked with contacted me and let me know what an impression I had on basically helping him save his own life from a direction that he was taken. I was able to see this patient for a while longer than you would in a civilian community. We were able to get this patient to a different place, a safer place, and long after that he contacted me and he let me know that I helped him save his life. It's those kinds of stories and those kinds of situations that I never thought I'd find myself in, halfway around the world, helping someone, but I'm able to do that at the Navy. I'm able to have leadership opportunities that I don't think I would have been able to have as a civilian. I'm able to meet a lot of professionals from a wider variety of backgrounds that I would not have been able to do in my previous jobs. I've been to Europe and I've been to Japan, I've been to Singapore, in just the short amount of time that I've been in. And so those are wonderful experiences that I would never, ever trade. Likewise, I've been able to witness things I never thought I'd witness. Now more than ever before, it's a great time to become a Navy social worker because there is not only financial incentives and career incentives, but there's a growing community of fellow professionals who wear the uniform. To make the transition from a civilian to an active duty social worker, the Navy made it really easy. It was a matter of contacting the Medical Recruiting Command, and I was able to begin practice within a month. Being a social worker in the military service gives you an opportunity to be both a professional in your practice, with whether it be mental health, whether it be therapy, whether it be case management or family services, but also be a leader as an officer within the military service. I love being able to say to colleagues or to family members, yes, I'm still an officer in the Navy. Yes, this is what the Navy's been doing around the world, and that I represent that.